Good evening. This lecture is about cardiomyopathy. It's a group of myocardial diseases result in cardiac dysfunction, and it can be classified into either dilated cardiomyopathy, hypertrophic, or restrictive. In this lecture, we will discuss dilated cardiomyopathy, or DCM for short. It is by far the most common form of cardiomyopathy, consists about 90% of cases. It can be defined as progressive cardiac dilation with systolic dysfunction. What do we mean by systolic dysfunction? Here we have normal cardiac cycle begin with diastole and end with systole. During diastole, there is relaxation of the ventricle to fill in with the blood, and during systole, there is contraction of the ventricle to eject the blood out. If a failure of relaxation occur, it will called diastolic dysfunction. A failure of contraction called systolic dysfunction. In this type of cardiomyopathy, there is systolic dysfunction, يعني الفيل of ventricle to effectively eject blood or contract. Regarding the causes of dilated cardiomyopathy, it can be divided into idiopathic or primary causes or secondary. And secondary can be caused either by infection of myocardial wall and called myocarditis. This infection could be caused by viruses such as Coxsackie virus type A or B, or by parasites. Other causes include alcohol abuse. Alcohol and its metabolites such as acetaldehyde have direct toxic effect on myocardial cells. Other cause is drugs, especially chemotherapeutic drugs such as doxorubicin. Genetic factor, ischemic heart disease, and also peripartum. Regarding pathophysiology of dilated cardiomyopathy, normally there is sarcomeres in the myocardial layer, which is a unit responsible for contraction, consists of actin and myosin filaments. These sarcomeres are arranged in organized fashion. In dilated cardiomyopathy, these sarcomeres will be added in series, or what is called eccentric hypertrophy. This series will create dilated but relatively weak walls. These walls are unable to contract effectively, thus results in systolic dysfunction. Regarding clinical features of dilated cardiomyopathy, it can occur at any age, but most commonly between the age of 20 to 50 years. It typically manifests with signs of slowly progressive congestive heart failure. يعني أغلب البيشنت يجون with signs and symptoms of heart failure such as easy fatigability, poor exercise intolerance, signs of left side heart failure such as dyspnea، يعني يجي عنده shortness of breath، ضيق في التنفس، يجي orthopnea يعني shortness of breath occur when lying down، paroxysmal nocturnal dyspnea يعني shortness of breath occur during sleeping. It may also lead to complications such as abnormal cardiac rhythms، يعني البيشنت with dilated cardiomyopathy يصير عندهم arrhythmia and embolism. This table demonstrates the difference between left side heart failure and right side heart failure. In patients with left side failure, it will be present with dyspnea, orthopnea, or paroxysmal nocturnal dyspnea, while in patients with right side failure, present with bilateral lower limb edema, hepatomegaly or increase the size of the liver, and distension of neck veins, mostly jugular vein. Patients with dilated cardiomyopathy usually present with biventricular failure, means both left and right side failure. Regarding morphology in dilated cardiomyopathy, the gross picture demonstrates an enlargement of the heart about 2 to 3 times its normal weight. It also shows a dilation of 4 chambers, and the heart becomes floppy, means soft or loose. Regarding a microscopic feature, there is hypertrophy of myocardial cell or myocytes with prominent nuclei. and between them there is interstitial fibrosis or collagen deposition. In this case, we have 50-year-old male alcoholic is seen in the clinic for complaints of difficulty breathing, particularly at night when he is lying down. He has not had chest pain or diaphoresis. Physical examination reveals that the cardiac point of maximum impulse is laterally displaced on the lungs. Bilateral basilar rails are heard. A chest radiograph shows an enlarged heart and bilateral pleural effusions. An echocardiogram is performed and reveals a markedly low ejection fraction. نفصل الكيس. عندنا male alcoholics عمره 50 years. Complain of shortness of breath particularly at night, يعني complain of orthopnea. On physical examination, the point of maximum impulse or what's called the apex beat is laterally displaced. شنو يعني؟ the point of maximum impulse, other name apex beat, it is the lowermost lateralmost point at which the cardiac impulse can be felt on examination. شلون نقدر نحددها بالprecordial examination، يعني examination of cardiovascular system. Normally this point يعني apex beat located in the fifth intercostal space at the level of mid-clavicular line. هاي normally الموقع مالته. هنا نقدر نتحسس الكارديك impulse. When this apex beat is displaced، يعني displaced مثلا laterally or downward، this means that the heart is enlarged. من يصير زيادة بحجم الهارت، هاي البوينتس راح يصير بيها تغير بالموقع. فهذا البيشنت عنده displacement of apex beat laterally. إضافة إلى ذلك عنده rails اللي هي abnormal respiratory sounds heard when the alveoli filled with fluid، يعني إن هذا البيشنت الالفيولار مالته بيها fluid. chest radiograph يعني chest x-ray demonstrate enlarged heart، زيادة بحجم الهارت، وعنده bilateral pleural effusions. Pleural effusions means the presence of fluid in the pleural space. عندنا normally هاي lungs وعندنا pleural space. Pleural space هي space between the visceral pleura and parietal pleura. This space is full of fluid bilaterally in this patient. طبعا احنا شلون نشوفه بالchest radiograph؟ نشوف على شكل opacity يعني أبيض و obliteration of costophrenic angle. An echocardiogram is performed. echo reveal low ejection fraction. Ejection fraction means the index of ventricular contractility، يعني يقيس معدل ventricular contractility normally من 50 to 75%. إذا less this normal percent، يعني مثلا less than 50 أو يكون 40، هذا معناته low ejection fraction. low ejection fraction reflect low ventricular contractility، يعني this patient has systolic dysfunction. شلون عرفنا من الإيكوكارديوغرام. History and physical examination of this patient reveals left side heart failure, and investigation reveals that the patient has enlarged heart with low systolic function. So the most likely diagnosis for this patient condition is heart failure secondary to dilated cardiomyopathy. The underlying mechanism for dilated cardiomyopathy is the effect of alcohol on myocytes, and this effect is mediated by acetaldehyde. In addition, alcohol has an important role in the pathogenesis of atherosclerotic coronary artery disease, and this also enhances the formation of dilated cardiomyopathy.